Hey folks, it's Dr. Gerstmar from Aspire Natural Health. I wanted to talk today about a test that we use fairly frequently and answer some common questions. So this is from Genova. This is the Organix or organic acid test, again known as the Organix. It comes in the small box and is a urine test. We're using it a lot. It actually covers a broad range of things like various deficiencies, looks at your metabolism, looks at detoxification, looks a little bit at neurotransmitters, and gives us an indirect marker of gut health. So a tremendously useful little test, all kind of jammed together, and it's urine, which is wonderful because that makes it easier. So let's go through it, answer some common questions. So again, we have the small box, and on the front, just like all the rest of the Genova tests, we have our little plastic pocket, which contains our form. So let's take just a moment to go through the form. So we'll go ahead and open up the form. Again, very similar to all the other Genova forms. So if you're doing any of the Genova tests, they're going to be quite similar. We can see there's a space here for the signature. So let me just say again, if you had an in-person visit, I will have signed this form. If we've sent it to you, it will be unsigned. But because we've specifically sent it to you through and from Genova, they're aware of that and they don't need that signature. It is perfectly fine. So you don't need to call and ask us what to do. They know about it. It's all good. All right? Then there's the payment option. So again, this should be checked for you, but if it does come unchecked, just to be aware, there are typically two payment options. There's the Easy Pay program. If you're not up to speed or familiar with the Easy Pay program, please watch our video on the Easy Pay program so that makes sense. Otherwise, you're looking at the no insurance cash only pay. If you're doing the Easy Pay, we will have checked, or we will need you to check some of the boxes with the diagnosis codes. Now, we almost always do the Organix Comprehensive, so this top option should be checked as well. The only thing that's left for you to check is the top, which is the date that the sample was collected. Okay, so once again, just a quick review. Signature at the top. If it's here in the office, I will have done it. If it's been sent to you, it's not necessary. Payment option, Easy Pay or Cash Pay. The diagnosis codes, also called the ICD-10 codes, will have been checked off. If you're doing Easy Pay, if it's Cash Pay, they're not necessary. The Organix Comprehensive, almost always that choice will be taken. The only other thing is for you to put in the date. The back, again, exactly the same for all of Genova's tests. At the top, we're looking at your personal information. You fill that out. If you're doing an Easy Pay, you will fill in your insurance information. If it's a cash pay, then obviously no need for that. Payment type, again, credit card, check, HSA card, and signature at the bottom. So once again, personal information at the top, insurance information if you're doing Easy Pay, payment options, signature at the bottom. So please make sure it is filled out. Genova will not accept and process the test if this hasn't been filled out. So typically the best thing to do is to make sure it's filled out right after you get the test, except for the date and any time that the sample was collected. You'll do that after you collect the sample. We go ahead and open the box, take a look inside. This is what we're looking at. So we've got a little checklist, reminds you of what needs to be done. We've got their patient health assessment form they ask you to fill out that goes along, helps them correlate what they're seeing. Inside, we have one bag. On that bag, on the front or back, whatever it might be, but in the pocket, you'll find the instructions. We ask that, while I'm going to go over a few of them, we ask, please read the instructions before taking the kit or before taking the test, all right? We open that up, and there's one major thing that needs to be addressed for the Organix. In general, it's a nice, easy urine test. There's not a lot involved except for one thing, and that is simply that your urine needs to be really concentrated for the test. If your urine is really diluted, they're basically not going to be able to detect anything, and it's a waste of your time, energy, and money taking the test because they're not going to find anything. So you do need to take this seriously. It is a little bit rough, let me be honest with you. You don't need to stop taking anything. You can take any supplements, any medications, anything else. But according to their directions right here, you do need to decrease your fluid intake. For adults, they're recommending you restrict your intake to 3 8-ounce glasses of water in the 24-hour period before the test. Listen, I know that can be a little rough, so we definitely recommend not doing any vigorous physical activity, not being out in the heat or anywhere that you're really going to need to sweat. Most of the time, we're recommending just take it easy, have a day off, relax, don't do very much the day before. All right, so your restricting your fluid intake, it is the most major thing that you're doing. You're going to go ahead and pee that evening. So for example, if you're collecting your sample Sunday morning when you get up, Saturday you would restrict your fluid intake. So from when you got up Saturday to when you went to bed, you'd have no more than 3 8-ounce glasses of water. So you're really kind of rationing it there. You pee before you go to bed. At night, climb into bed. Now, any urine you're producing from the time basically you go to bed, so if you get up at night, you're collecting that urine, setting it aside. The trick is, if you don't have to pee at night, you're getting up in the morning, that first morning urine's the one you're collecting. If you did pee during the night, you're combining both any pee you had during the night and that first morning urine. So you're using a container. Really, we don't have one that's provided. Any type of container is fine, provided it's clean and not contaminated with something else, okay? Then you're going to go ahead and take the little pipette that's included here. One moment. The pipette that's included, you're going to take that, make sure the urine was mixed up, right, or combined. Take some and go ahead, unscrew, and transfer urine into this container, okay? Please don't overfill it. Screw on the cap tightly. You're also going to want to include the label. It needs to have your name or your initials on it. Now, the one other piece I should have covered, so the day before, when you're restricting water, you also take the cold pack here and throw it in your freezer. So let's just review real quick, make sure we're all on the same page. So pretend Sunday morning is the day you've chosen to go ahead and collect that sample. Saturday, you restrict from the time you get up in the morning till you go to bed, you're restricting your fluid intake. You also take the freezer bag, throw it in the freezer to freeze it. You pee before you go to bed Saturday. Sunday, if you pee at all between the Saturday night and Sunday morning when you get up, you do collect that in a clean container. If you don't, that's fine. When you get up in the morning, you're collecting that sample in the clean container. You're using the little pipette to transfer some urine over into the vial. That is it. It is easy to collect. It's just those two things, freezing the bag and more the hardest thing, which is fluid restriction. Hey folks, one piece that I forgot, so a little addendum. We talked about some of the necessary steps for this kit. We talked about dehydrating yourself, only drinking a little bit of water the day before. We talked about freezing the kit. Here's one thing that I forgot to mention, so we're adding this in. After you collect the sample, so you've collected the sample, you've transferred it over to the vial, then you need to freeze that vial. All right, so what we recommend is the day before you're fluid restricting, you also throw the cold pack in the freezer. You get up the next morning, you're collecting the urine, you transfer it into the vial, and then you put the vial into the freezer to freeze. All right, so last piece is that FedEx will pick this up Monday through Thursday. So the test itself is pretty simple. It's basically don't drink a lot of water the day before and collect some urine. Some of the logistics around it are slightly complicated, so it needs to go out Monday through Thursday, and you need to have frozen the urine sample, then put it in the bag along with that frozen cold pack. All right, wanted to add that in just in case. A little bit of complicated on the logistics side, but we absolutely know you can do it. All right, folks, thanks. All right, so you're pretty much good to go from there. Now the next piece is we take this sample to FedEx. You have two choices. You can take it to a FedEx location, either a drop box or into the location, and the drop box is there. You're good to go. You just have to drop it off. Or you can call FedEx. So again, you before you dropped it off, you'd go ahead and put it in the bag, put it in the box, and seal it inside this FedEx envelope. Then you could take it over to the FedEx location, or you can call FedEx. The number and the account number provided here. So you'd call the number, give them the account number, and they would arrange to pick it up either at your home or at your work. They don't ask what the sample is, so no need to be concerned that it's a urine sample. It's not an issue for them. They will arrange a time to come and pick it up. They drop by, grab the bag, and good to go. No other costs are involved to you. Just make sure, excuse me, once again, the vial is labeled. It's in the bag. The bag is in the box along with that frozen pack that we talked about. The box is inside the FedEx bag with the label on it. All right, folks, the Organix test is an incredibly useful test that we're often using. It picks up things that other tests like blood tests or stool tests often don't find, so we highly recommend it for people. You're going to be glad that you took it. A lot of good information comes out of it. It is simple, just a urine test, but the most important point is that fluid restriction. I have to emphasize that again. We understand that it's a pain to do. It generally means you're taking a day off, no hard activity, no big sweating or anything else that gets you too dehydrated, but you need to be slightly dehydrated to concentrate that urine so that the test can find the thing that it's looking for. All right, folks, if you have any questions, concerns, any troubles, anything at all, please feel welcome to contact us. You can contact the front desk. Our number is 425-202-7849, or go ahead and drop us an email. All right, folks, until next time, take care.